Well, every month is the perfect month to remind you to take care of you.
Right now, colon cancer is on the rise in younger adults, but there are some things you can do to reduce your risk or catch it early. Dr. Gerald Gantt joins us with more. Welcome to the show, doctor.
Thanks for having me.
Oh my goodness, this has been such a hot topic because we're just seeing all these news stories about how younger people are now getting diagnosed with colon cancer and advanced colon cancer.
Yes.
Yeah, can you tell us why that is?
Yeah, unfortunately, we've been seeing an increase in people under the age of 50 being diagnosed with colon cancer, and this has been going on for the past 15 years. And the medical community has responded by lowering the recommended screening age from 50 to 45. And that's great, but it's still important that people get checked out, especially if you know you have a family history or if you develop any signs of symptoms.
So why do you think it is that we're seeing this increase in younger adults?
We're not really sure. There's a lot of thoughts and some speculation. There's a lot of active research going on at UI Health and other institutions to look into why. There's a number of theories, including things like diet and environment, people eating more processed foods, even things like microplastics. So we don't have the answer yet, but it's still important that people are aware and so that they don't ignore any symptoms.
Can you talk a little bit about, is the cancer that you're seeing in younger adults different than the traditional cancer maybe you saw in older adults?
Sure. One of the things that we're noticing is that, unfortunately, because younger people aren't getting screened, they actually don't come to us until they start having symptoms. So that, unfortunately, means that their tumors are usually more advanced, and they may be even spread to other organs. So that can make it more difficult to treat. It may involve more intensive treatments, and unfortunately, sometimes can have worse outcomes.
Okay, so let's talk about some of those symptoms for people. What are we watching for? What should be those red flags that we say, okay, it's time to go into a doctor?
Absolutely. So we never want to ignore rectal bleeding. And unfortunately, we commonly hear a story where, I've had some blood in my stools. I was told it was hemorrhoids, so I just kind of let it go. But you don't want to ignore it. You want to talk to your doctor about it. We also want to look at change in bowel habits, so constipation, kind of always feeling bloated. That's not normal. So you want to get that checked out. Any type of fatigue or weight loss, or if you have low blood count, those are symptoms that you should discuss with your doctor about getting further workup. Oh my goodness. So don't just dismiss it as a bad tummy, or I know a lot of people kind of self-diagnose themselves with
ChatGPT.
They say, I have IBS. I'm like, did you get an official diagnosis? Or are you just telling yourself that? So that's what you're seeing a lot, right?
Absolutely. And it's great that people have access to all this information, whether it's online or AI models. But it's always important to kind of run these things by your physician so that they can verify that everything's right and that there's not any further workup that's needed.
Are there things that we can be doing now to prevent, or is it if you're going to get it, you're going to get it?
So all cancers are a combination of genetics and environmental factors and behavioral factors. So for colon cancer, we know there are some things that are associated with getting colon cancer. So a lot of this revolves around diet. So eating too much red meat, we know is associated with developing colon cancer. We want to eat a high fiber diet. That can lower your risk. So you want to eat fruits, nuts, whole grains, lots of greens. You also want to manage your weight. Obesity is associated with colon cancer, and also a sedentary lifestyle. So you want to try to remain active. So kind of all the things that we know or we should be doing anyway, you really should do in terms of colon cancer.
Now, should women be approaching this differently than men? Are there different kind of recommendations?
Overall, no, but in terms of the fiber recommendation in particular, we do recommend 30 grams of fiber for men and about 25 grams of fiber per day for women. And most people can, if you try, you can eat that much, but if you can't, then take a fiber supplement in addition to it. And it's good not just for colon cancer, it's also good at managing your weight, helping you feel full, and a lot of other things. So it's just good for overall colon health.
All right, let's talk about the dreaded colonoscopy. People, I think, don't get checked because they don't want to go through what you got to go through to get checked. But it's not, there's different options now of how you can prep for this, correct?
Yes, they do offer different preps. Some of them are lower volume, so it's a little bit easier for people to take. What I always tell folks is that the procedure itself is very safe. It usually doesn't take more than about 20 or 30 minutes. And the worst part is actually the prep, just going to the bathroom. And that's it. It's just going to the bathroom.
Well, didn't I hear there's a pill potentially too that you could take?
There are pill forms. Usually each institution will have their own preferred method of cleaning the colon. The other thing that's important is that you watch what you eat the day prior to the colonoscopy. So most folks need to be on a clear liquid diet the day prior to the colonoscopy to make sure that your provider can get a good look at the colon to properly assess for any growths.
Yeah, don't do what I did, because I just thought you could eat willy-nilly whatever you wanted and then do the prep.
That was a fun prep night.
You have to eat well before you start the prep.
That's right.
I can't even enjoy my Netflix.
Yeah, and because
crazy.
I don't know a ton of my family history, I decided to go earlier too, as well, which I think that's something to consider as well.
Absolutely. Family history is very important.
Yeah.
We know that most people who get colon cancer, it's what we call sporadic, meaning that there's no family history. But for every maybe 1 in 3 people, there will be a family history. So if you have a first-degree relative, a sibling, a parent who has a history of colon cancer or advanced polyps, you definitely want to know that and talk to your doctor about getting screened early.
Dr. Gantt, UI Health, thank you so much for being here. We really appreciate it. Good
Thank
stuff.
you for having me.
For more details, you can scan the QR code on your screen. You can also head to colon.uihealth.care or find them on the socials.